this is your patient and you can go ahead.
Okay, doctor, can you just introduce me to the patient and say, my name is Angad and I'm going to be helping diagnose you today?
All right. Wannan sunan shi Angad kuma zai taimaka kamar wancan wajen gane me yake damun ki ko sai rubuta magani. Ba damuwa? Okay. I introduced you and she's pleased to be with you.
Okay. Could I ask a couple of questions, like her name and her occupation and who she lives with? Just a couple questions.
All right. Wai yana so ya san sunanki da shekarunki da kuma da wa kike zaune, kin gane? Da kuma me kike yi in kina aiki. In ba ki aiki kuma ki iya cewa ba ki aiki. In kina sana'a a gida ki iya faɗa. To ki faɗa min duk abubuwan da na tambaye ki. Kina zama da mijinki ne? Shekarunki nawa? Okay. Ba ki sana'a a gida? Okay. All right. She said her name is Aisha Misu. She's 20 years old. She's married with 3 kids, and she does petty business at home. She actually sells a local snack, puff puff, at home. So that's what she does.
Okay, thank you for that. Do you mind asking a couple of her symptoms and why she's at the hospital? Just.
All right. Wai me ya kawo ki asibiti? Me yake damun ki? Okay. Okay, she said she actually has been feeling unwell for the past 1 week with complaints of fever, headache, and abdominal pain of 1 week duration.
Okay. Can I ask a couple of questions about the symptoms?
Sure, go ahead.
Okay. Can you ask her if the fever is on and off or is it always there?
Wai zazzabin nan yana nan ne ko da yaushe ko yakan je ya dawo ne? Yakan je ya dawo. Akwai lokacin da yafi yawa ne kamar da safe ne ko da yamma ko da wani lokaci? Okay. She said the fever is usually on and off. It's more during the evening hours.
Okay, thank you, Dr. Holmes. Could you tell me her temperature, doctor?
Yes, we took her temperature. It's actually 37.8 degrees Celsius.
Okay, thank you. Does she have other symptoms like weakness or headache?
Wai kina jin kaman jikinki ba ƙarfi ko ciwon kai? Kasala ba? Akwai ciwon kai? Okay. Yes, she said she has generalized body weakness and headache.
Okay. Does she have a loss of appetite at all or skin discoloration?
Okay. Wai kina kaman akwai wani ko kuraje ne a jikinki ko kuma kina ji kaman cin abincinki ya ragu? Okay, she said she doesn't actually have any loss of appetite or skin discoloration.
Okay, can you ask her if she has diarrhea or stomach pain?
Akwai ciwon ciki ko gudawa? Ba gudawa amma akwai ciwon ciki. Ciki fa nake tambaya. She said she doesn't have any diarrhea, but she has some abdominal pain.
Okay. I believe she has malaria, but doctor, could I have the results of the rapid diagnostic test for malaria?
Yeah, we actually did a blood film that
Okay.
showed malaria parasites with a density of 1 plus.
Okay, and was there a full blood count or hemoglobin level?
Yes, and the hemoglobin level is 12.5 grams per deciliter.
Okay, so
And
she
we
does not
also,
have anemia, but
okay, yeah, she
she
doesn't
has
have,
malaria, but no anemia, right?
yeah, yeah, certainly. And
Um,
we also did a Widal test for typhoid fever, and it showed significant titers for Salmonella typhi.
okay, so she has typhoid fever as well. Okay. Could I talk a little bit about the treatment now?
Yeah, sure, go ahead.
Okay, so for the malaria, I would suggest ACT, artemisinin-based combination therapy.
Okay, go ahead.
And I believe for the typhoid fever, the best treatment is antibiotics and just hydration, just getting a lot of water to drink. And could I talk a little bit about prevention so she doesn't get it again?
Any antibiotic of
Oh,
you want
yes.
to recommend? Can you recommend any
Um,
antibiotic?
I believe it's amoxicillin or
Okay, good. Right.
ciprotab.
Yeah, super tab, good. So you can talk about the prevention now.
Okay, so I believe in the future, maybe to avoid getting malaria again, she should use mosquito nets or wear long sleeves so she doesn't get bitten by mosquitoes and avoid still water.
Okay. Okay. Let me explain to her what you just said. Ya ce wai yana da kyau idan kina so ki kare kanki daga cutar malaria sai ki amfani da dogayen kaya, sai musamman a gida saboda kar sauro ya cije ki kuma kina kwana a gidan sauro. All right. All right. Do you want to say anything again about the prevention of typhoid fever or something?
Yes, doctor. So for the prevention of typhoid, maybe washing the food before she eats it and making sure just washing hands and general hygiene, I believe. Prevention of typhoid.
Okay. All right. Ya ce wai saboda ki kare kanki daga cutar typhoid, za ki iya wanke hannunki, sannan kuma a tsaftace muhalli, ko sannan kuma ya zama ana shan ruwa mai tsafta, musamman ruwan da aka tafasa aka bari ya huce. So I've actually explained all that you said, and she is actually happy with your diagnosis. And she said she would try as much as she can to follow your advice on preventive measures.
Okay, thank you. Could you tell her I wish her a speedy recovery?
Okay, wai yana miki fatan Allah ya ƙara sauƙi ko? She's saying thank you. So is there any other thing you want to add?
No, I think that's it for the diagnosis. Just thank you for letting me diagnose you, and thank you, doctor.
All right, you're welcome. And in the next second, I will switch the camera again. So you should be able to see each other with your patient, and then you can wave her goodbye. Then I will add one or two things to what you've said already. Okay?
Okay.
All right. So
All right.
She's so grateful that with her diagnosis and treatment. And I'm also pleased with your performance. I think you did wonderfully well. Just to add one or two things, you can As well, look out for some clinical signs. Okay, you can look at the palms of the patient or the conjunctiva of the patient. If there are any pallor, if there is any pallor to suggest anemia. Okay, and malaria can present either as an uncomplicated form or as severe malaria.
Yes.
So you can ask other questions to indicate the severity of the illness, like if the patient is passing dark colored urine, okay, to indicate hemoglobinuria, or if the patient has any history of altered level of consciousness or what have you. But overall, I think you did wonderfully well, and congratulations.
Okay. Thank you, doctor, for helping me with the diagnosis, and thank you for the feedback.
You're welcome, Angad, and have a good day.
Same to you.